Acne is a skin condition that commonly occurs amongst adolescents and is often ignored by parents. But if not managed and treated correctly, it can not only leave physical scarring, but do serious psychological damage as well.
In 2010, it was estimated that acne was the 8th most common disease globally, affecting 650 million people and approximately 80% of teens in the Western world.
Doctor, what exactly is acne?
Acne is a condition that occurs in teenagers and continues in adulthood, where one gets pimples on the face, commonly known as zits. What essentially happens is that you get increase in testosterone, both in male and female, and the testosterone comes into the skin and it stimulates the sweat glands called sebaceous glands, which produce oil or sebum, and the oil or sebum comes into the skin, and on the top layer of the skin it blocks up the pore of the skin. So when it blocks up the pore, initially you get a white head, and then you get a black head, and then if there's inflammation you get pus, and that's where bacteria called P. acnes causes the inflammation, and one gets pus pimples, and from there one can get deeper cysts and then nodules. 80% of teenagers and adults would have acne. Some may be mild, some may be moderate, and some may be severe.
For most people, acne diminishes over time and tends to disappear or decrease by age 25. Some people carry the condition into their 30s and 40s or beyond.
If not treated, what psychological effects can occur?
Acne is a disfiguring condition. Often you find that youngsters, teenagers have these zits, pustules, marks, very oily skin. Acne causes scarring. Scarring can be disfiguring, it can be problematic. So this can have a negative impact on the patient. And we find that some patients with acne, they can often have anxiety and depression. At the first onset of developing acne, they should go to the general practitioner or dermatologist, because it is important for us to diagnose the type of acne. We get the mild acne, we get the moderate acne, and the severe. And depending on the type of acne, we will be able to use the appropriate therapy. So it is important they seek treatment early, because the treatment actually can prevent scarring.
There is no way to predict how long it will take for acne to disappear entirely. But in the meantime, there are fantastic treatments to help keep the skin clear and healthy.
There are many treatments available, but in a medical clinic or a dermatology clinic, we offer microdermabrasion or chemical peels. And the benefit of those, you get different fruit acids. And what they're going to do is kill the bacteria of the pimples. So they're going to relieve the symptoms and improve the appearance of the skin. Medication is still important though, because you need to treat it systemically. And what we're going to do today is a glycolic acid peel to kill the bacteria, to control the oil secretion, and to prevent further infections and pimples. Normally you would need a course of treatments. Once a month you would have a treatment to improve the condition. If however the acne becomes worse, then the patient would need to go back to the dermatologist. Or if a patient hasn't seen a dermatologist, we would refer them as well.
Who is most suited for this kind of treatment?
Anybody who's concerned about pimples should have a treatment. Even if you're getting 1 or 2 pimples a month, it's still regarded as acne. You get different grades of acne, so it's not severe, but if you don't treat it, it can become worse. If someone, however, is on strong medication, we may not treat them because their skin will become too sensitive to the treatment. So there are other options for them as well.
If you're on any medication for acne, you must let a skincare professional know this prior to receiving an external skin treatment to avoid complications.
Rene, how does this machine treat acne differently as to what we've seen so far?
This is called the TheraVent Clearer Vacuum Light System. It actually works off 2 modalities. It vacuums and extracts the comedones or pimples, and then there's 2 wavelengths of light. There's 500 to 600 nanometers and 800 to 1000 nanometers, which basically works to reduce the inflammation and redness often associated with active acne, as well as then killing the Propionibacterium acnes, which is the bacteria that's actually responsible for your acne.
Sage advice from all doctors and dermatologists is to not pick or pop pimples, which are the result of acne, as this can lead to skin darkening or scarring.
Penny, how can we treat scarring?
There are many ways to treat scarring, but it depends on the depth of the scar. So if someone has very deep scars, you need to be able to penetrate deeper into the skin to repair and remodel the collagen. If it's superficial, chemical peels or microdermabrasion will work. But in the case of pitted scarring, we need to actually use a laser. This machine here is called the CO2 fractional laser. It's the most intensive and penetrates the deepest. And what will happen with time, the collagen will remodel and the appearance of the scar will look better and it will be smoother. One can never get rid of a scar completely, but we can make it look better.
The relationship between diet and acne is unclear as there is no good quality evidence, but a healthy lifestyle can help to give your skin a fighting chance at recovery.
Acne is not a problem to be taken lightly and should not be ignored by parents. It's encouraging to see there's so many different medications and treatments available to manage the problem. I just wish that I knew about them when I was a teenager.